Oh, welcome everyone. We are really thrilled to see such a high level of interest in this webinar, and we truly appreciate you taking the time to be here with us. My name, for those who don't know me yet, is Sonja Weigersdorfer, and I work at the Deggendorf Institute of Technology at the Health Campus Bad Kötzting. This is a small town in the northeast of Bavaria, close to the Czech Republic. As the project lead partner, I'm delighted to present the project to you today. Before we begin, I would like to remind you that this session is being recorded and can be viewed again afterwards. Your camera should currently be automatically deactivated, but I saw that this is not the case everywhere. So please check once again and switch off your camera if you don't want to appear in the recording. With that, let's dive in. So this is our program for the next 1.5 hours. First, we will start with an introduction to the DigiCare4CE project. Then Ida Sweber will provide us with valuable insights into the DigiCare4CE model, a framework for implementing digital transformation in long-term care facilities. Next, Oscar Sanuto will guide us through the self-assessment tool, which allows long-term care facilities to evaluate their level of digitalization compared to their EU peers. Finally, Martin Dujak will introduce us to the DigiCare4CE online check, where insights from the model and the self-assessment come together in a comprehensive and accessible way for long-term care facilities. Pavel Jirek will wrap up the meeting and give us a quick look at the upcoming project event. But before we go into more detail about DigiCare4CE, we are curious to know where you are joining us from. That's why we set up a Mentimeter survey that you can join by scanning the QR code with your smartphone or your tablet, or by going to menti.com and entering the numerical code shown on the slide. Please log in now and don't close the application afterwards. You will need it again. So you have about 1 minute to answer, and responses are coming in. So quite interesting, the diversity of the countries where you are joining us from. Good, thanks a lot. So let's begin with the hard facts. DigiCare4CE was launched in March 2023, and we are now already approaching our last project year. Funded by the Interreg Central Europe program, we aim to analyze and present practical solutions for the challenges Europe is facing in inpatient long-term care. The project's mission is to increase the level of digitalization in the sector of long-term care. Our common starting point is the growing number of elderly people accompanied by an increasing shortage of skilled labor in the care sector. As we all know, this will reshape professional care in the near future. And at the same time, the potential of digitalization remains largely untapped. This is where our project comes into play. In DigiCare4CE, we investigate the impact of innovative digital solutions and compile this knowledge into transnational action plans, providing the management, in other words, owners and operators of long-term care facilities, with a comprehensive strategy for a digital transformation. To achieve this, we started with an analysis of the potential and feasibility of digitalization, conducted market research, and in collaboration with long-term care facilities, implemented, monitored, and evaluated innovative and care supportive technologies, such as software products for health data recording or data exchange, smart fall sensors, VR-supported cognitive trainings, and digital wound management apps. Based on these findings, we have developed the DigiCare4CE online check, which we will present to you in this webinar. In the next step, we will, together with our cooperating long-term care facilities, develop customized innovation plans, which will serve as a blueprint for regional digitalization strategies. Our main project goal is to support decision makers in the sector with practical tools and guidelines to initiate and manage the digital transformation process, which should evolve into an ongoing strategic priority. And this is us. The project consortium consists of 10 partners from different fields and countries. As universities, the Health Campus of the Deckendorf Institute of Technology in Germany, the Czech Institute of Informatics, Robotics and Cybernetics in the Czech Technical University in Prague, and the Technical University of Košice in Slovakia. From Aging Research, the Anton Trstenjak Institute of Gerontology and Intergenerational Relations in Slovenia. As operators of care facilities, the Health Agency of Lower Austria, the Geriatric Health Care Centers of the city of Graz in Austria, and the Institute of Older Care and Sheltered Homes in Italy. As sectoral agency, the Association of Social Service Providers in Czech Republic, the European Grouping of Territorial Cooperation via Carpathia in Slovakia, and the Rzeszów Regional Development Agency in Poland. Now we would like to have your opinion. Please switch over to Mentimeter and let us know what you think are the most needed digital solutions in long-term care facilities in your country. Yeah, we see some familiar technologies. Mhm. I will give 1 more minute. Oh, I see that I can't. So now it's open again. Maybe there are some more ideas. Sharing of data, data transfer, fall is a huge topic. Loneliness prevention. Good. Seems that not that much other technologies are mentioned. I try to stop the timer. It doesn't work. And try to sort the questions. Yeah, documentation system, fall prevention communication tools, data integration. Perfect. Thanks a lot. So that's it from my side. This was a short introduction into our project. If you have any questions, feel free to open your mic and ask, or feel free to put your questions into the chat. So there are no vocal questions. So from my side, I will thank you for your attention and hand over to my colleague Ida. Ida, please, the floor is yours.
Thank you, Sonia, and also from my side, one more warm welcome to everyone. My name is Aida Cvilbar. I come from the Anton Trstenjak Institute in Slovenia, and today I will present the DigiCare4CE model. As was already mentioned in the introduction before, the model is, together with the self-assessment tool, the basis for the online tool, which will be presented in the second part of today's meeting. Why transnational DigiCare model? As we all know, all European countries and actually all countries in the world face challenges in the field of the long-term care, like the severe shortage of staff. DigiCare4CE partners recognize the importance of promoting digital solutions as one way to relieve the burden on staff and to improve the quality of care. Current range of digital solutions on the market is quite diverse, but often very confusing. Therefore, the long-term care facility management is faced with a difficult task when trying to find and implement a solution, a suitable digital solution. So the main aim of the model is to support digital transformation of the long-term care facilities for older people. The model itself provides a clear and systematic framework for digital transformation, defining the most crucial stages of this process. The model itself was developed in, let's say, multi-phase process. We started by a comprehensive literature review, which provided a solid foundation. We continued with two questionnaires involving all project partners, as well as the management and staff of the long-term care facilities, where we were carrying out the pilot activities. That helped us developing the model based on the realization that, of course, each facility has its own specifics that need to be considered in this process. As it's written, the model is learning living document, and that means that the model has evolved over the course of the project and has also been improved during the implementation of the pilots in which DigiCare4CE partners supported the facilities in the process of implementing new digital solutions. During our literature review and also best practice review, we already realized that it is very important that we all use the same understandable technology language. This is why we started the model by clarifying the basic terms: long-term care facilities, digitalization, digital transformation, digital maturity, digital literacy. Since the model was developed by all consortium partners and as a part of the INTERREG project, it is an open access document. As of today, the model is also available in digital format as we have digitalized it for making it easier to use. The model is available on the DigiCare4CE online tool, which was also developed as part of the project and will be introduced further in the second part of today's meeting. To reach a research audience, scientific article was also written and published in Slovenian journal Good Quality of Old Age. As for accessibility, as mentioned earlier, the model has evolved throughout all phases of the project, and we are already considering further improvements. The first upgrade will happen very soon, as the model in digital form will be available in all 6 languages of the project partners. In the next section, I will present a very brief overview of the content of the model. As we already said, the Transnational DigiCare4CE model creates a reference framework for the digital transformation. When we as an organization decide on a technology, we sometimes focus too much on the technology itself and not enough on the whole process itself, which is a very complex, of course, and needs to be defined from different perspectives. We wanted to help with this by presenting this whole process step by step, pointing out at each stage the areas where we should pay particular attention. The figure here on the page shows the basic concept of this process, which was, of course, further explored in more detail later on. Now, let's dive deeper into the model. But even before that, I would like to ask for your help. So let's re-enter the Mentimeter together again and answer this open question together. In your opinion, what is needed to carry out successful digitalization in long-term care facility? Think about the time before we start this project. So what has to be done before we start the digitalization process? Please enter the Mentimeter on the code on the left and write down some keywords.
Some participants already used your introduction to fill in first ideas.
Very nice.
So we are already in the middle of getting responses.
Founding, communication, market research, co-creation, money, of course, financing is always a problem. Wi-Fi connection, great. Shared decision making, needs assessment, motivation, great. Involvement of staff, co-creation, yes. Involving employees, training, budget planning. Bottom up. Talk to end users, yes.
I'm wondering where the Wi-Fi and the stable internet is.
It was written above, yes.
Maybe I have overseen it, yeah. Then once again, I try to group the responses as there is a decent number.
Great.
But won't let me group the responses. I'm sorry for that. Maybe we can do it afterwards or in the meantime.
Of course, yes. I will return back to the presentation. Yes. I think it works. Thank you all for your replies and very good starting points. Also, in the context of the model, we have recognized that we need to be well prepared before we even start implementing a new technological solution. And of course, in the beginning, for preparing the ground, quality needs assessment is crucial, as we will see later on. Every transformation, of course, starts from the idea that something could be or should be different. But of course, not all ideas have the same transformative power. For a successful transformation, it is important that the idea comes from a genuine need and desire to change. Furthermore, it is also important that the need is understood and desire shared by all. So the decision makers, managers, other employees in the long-term care facilities. For that purpose, we also made a checklist that you can use. This checklist, as is presented on the slide, is available on the DigiCare4CE online tool, which will be presented later on. Usually the checklists are written in the question forms, so you can use them in your day-to-day workplace. As we have also found throughout our responses, in addition to good idea, there is also a need to prepare well before we start the process. At the beginning of this process, a good analysis of the needs of our organization is crucial, as well as the importance of enabling co-creation. Good preparation is the key. Analysis of the current situation in the long-term care facility is important because it helps to identify specific needs, inefficiencies in workflows, and ensures the chosen technology aligns with the facility goals. This is why we need to know our institution well. We have to know our staff, our end users, our workflows, and the challenges that require change. It is also important to take a long-term view of the process, looking beyond the current benefits and thinking about the long-term meaning and the long-term impact for the whole organization. So both the management and the employees, as well as our end users. Co-creation is of course essential when implementing new technological solutions in long-term care facilities because it ensures that the technology aligns with the real needs of the residents, caregivers, and other staff, managers, and other stakeholders. As we also know, resistance to change is quite common in healthcare settings. So co-creation also fosters engagement, making this transition smoother by integrating new solutions into existing practices more naturally. We are now slowly moving into the next stages of the digital transformation process, the time between the digital transformation itself. What is important during this time? Again, I would like to ask for your participation. Let's re-enter the Mentimeter and answer the second question together. In your opinion, what is needed to carry out successful digitalization in long-term care facility? This time, think about the time during the digitalization process. What do we need to keep in mind during the process? Please write down some keywords and we will check them together.
So I see monitoring is quite of importance.
Mm-hmm.
Feedback loops, support.
Great.
Training, yeah. Probably also something that was meant by support.
Mm-hmm.
User-friendly tools, easy to use.
Ongoing support, yes.
And it was ranked as the most important thing to keep in mind at the beginning already of the process is talking to end users, communication with staff. So this is crucial. Let's see if it...
Monitoring. Great.
Consideration of resources.
Disability. Leadership. Great. Thank you again for a lot of good inputs. I will switch back the presentation. Thank you again for all the inputs and all the words shared. Yes, in the meantime, during the process, it's really important to keep all relevant stakeholders involved, regularly informed, and to monitor process. As we saw, a lot of words were monitoring. This also helps us to identify any problems and challenges that users of the new technology may be facing. We need to make sure that users, especially employees of the new technology, feel that the new technology really makes sense to them and that it makes their work easier, not just more complicated, and especially easier in the long term. We must therefore support them and help them throughout the digital transformation process, not just during the initial preparation and training. After the initial idea and concrete preparation with needs assessment, we finally have to decide which digital solution to choose. In doing so, the DigiCare4CE model has identified a number of important points we need to pay special attention to. Here on the left, you can see the 5 points I will address shortly. The first one, of course, for clear communication with all concerned, from organization selling the product to developers and people using the technical solutions, common terminology is very important. This is why the first point of this section is devoted to classification. The model describes the World Health Organization classification, but this is just one idea, of course. In order to choose the best solution for you, market analysis have to be performed. While some digital transformation models offer lists of possible solutions, we reject such a model since we believe that the best solution for one long-term care facility might not be the best solution for another facility. No matter what solution you choose, you should keep in mind that solutions should be cost-effective, and market analysis can really help you with that. Technology readiness level and reliability tests serve as safety points for you not to choose underdeveloped or malfunctioning technology. When conducting reliability test or pre-test, you develop realistic scenarios that reflect the daily task and challenges faced by real employees in the long-term care facility. You may include a variety of situations to test different aspects, observe how users interact with the technology, and obtain detailed feedback regarding user friendliness, efficiency, reliability, and overall user satisfaction. Last but not least, infrastructure preparation reminds you that no matter how good the technical solution is, if you don't have good corresponding infrastructure, you cannot carry out successful digital transformation. The same goes for connectivity of the system with existing systems and its openness for integration. Again, in the DigiCare4CE model, you can find a checklist, questions, and other tips to help you along the way. Of course, other aspects are also important in this process. The following are also presented in the model. The first one is ethical and legal question they refer to elements, principles, behaviors, and other considerations that relate to both legal requirements and ethical standards. This category encompasses aspects related to ensuring that actions and decisions align with law, enabling safety, security, and privacy. The second one is communication and culture. This part of the model addresses the importance of early involvement of all key stakeholders, internal and external, management power, and effective communication. All that, together with a supportive organizational culture, is critical for overcoming resistance, fostering collaboration, and ensuring the successful adoption of new technology in a long-term care setting. Last but not least, training and education, as was already mentioned in your answers. Digital change is as much about people as it is about technology, and training of employees proved to be one of the most important factors in facilitating the digitalization process. Management needs to provide investments and opportunities in professional development, tailored training, and peer-to-peer learning. For this purpose, the model presents a concrete plan and checklist that can help you organize such training for employees or users of the new technology. During implementation, it is important to pursue common goals and to regularly check that all are being achieved. The model thus also addresses the three areas below in more detail. The first one is goal setting and development of internal digital transformation strategy with concrete, realistic, and shared goals that are motivators and provide a clear guidelines for all the people involved. The second, which was mentioned a lot of times today, monitoring. Of course, regular monitoring during the introduction of a new digital solution in a long-term care facility involves several key steps that are designed to ensure the successful adoption of the technology while addressing challenges as they arise. The DigiCare4CE model suggests monitoring steps with concrete examples. Evaluation. When carrying out digital transformation process and introducing new technical solutions, carrying out digitalization, it is important to understand the impact it has on the whole facility. For that, data collection is of course crucial. But furthermore, understanding the digital maturity of the long-term care facility and digital literacy of the employees who will be included in the process before and after the implementation can help you in developing and introducing appropriate training, plan for the future, develop digital transformation strategy, and together with regular monitoring, it will help you troubleshoot the issues as soon as they arise. As part of the DigiCare project, we also developed a self-assessment tool that can be used by long-term care facilities to self-assess digital maturity. This tool will be presented next by our ISRA partners. But now let's dive into the final phase of the process. After you finalize the implementation of the new technology solution, even after the implementation of the new solution, it is very important to keep an eye on the success of this implementation, also having in mind the next innovations in your organization. One last time, I would like to ask you to participate in this Mentimeter question. In your opinion, what is needed after successful digitalization in a long-term care facility? What do you consider to be the most important after the end of this process? Evaluation, cooperation, talking to end users, ongoing support, sustainability measures, optimization, presentation of results to end users. Getting the opinions, so feedback, dissemination monitoring, assessment, lessons learned for other projects. Evaluation, interviews, celebration. Great. Great to keep that in mind. Improving, questionnaires, initiatives. Great.
Yeah, keeping the
Great.
previous defined KPIs in mind. Keep going and expand the digital implementation in the organization. Perfect.
Great. Thank you. Thank you for the final inputs. Of course, feedback from everyone involved is very important. So feedback from the residents, from the staff, from management, and other stakeholders involved. It is good to ask users of the technology to tell us what has worked well for them and what could be improved in the future. It is important to let everyone involved know that we are very grateful that they have been involved in this process. This also encourages greater trust, cooperation, and a greater willingness to change and embrace change and new technologies in the future. It is also recommended, as one person also listed out, that we celebrate the completion of a successful implementation together, as this also gives us a sense of success and motivation for the future. This is it from my side. I just want to let you know that the DigiCare4CE model is available to download on the DigiCare4CE project website. This is the QR code on the left, and in the digital form, it is available on the online tool, which will be presented in the second part of our meeting. And now I would like to turn the floor over to our colleagues from ISRA, who will present the self-assessment tool. Thank you for your attention.
Thank you very much, Aida, Sonia, and good afternoon to everybody. This is Oscar Zanotto from ISRA. We are a public care provider organization based in Treviso, in Italy, and I'm the head of innovation and development department working on European projects and on this DigiCare4CE project. So let me share my presentation. It is about the self-assessment tool and the results that we have from an international analysis that we ran over 2024 summer. But before also here sharing what we have done, let me move to this quick survey. So again, please jump into Mentimeter, and we want to understand how does your organization currently approach AI adoption, because there's a lot of hype around what we can do with AI, which benefit we could have, which impact it has got in our lives and organizations. So we are thrilled to understand what is going on. So let's see. We are exploring solutions, a lot of people aggregated there, and then we have people who are actively using AI and other interested but haven't started yet. Okay, no plan for adoption. So interesting. We are, let's say, in this exploring phase, as we will also see in a while with our consultation that we did.
But one can clearly see that it's on its way.
Yeah. Okay. Anyone is skeptical about AI, it seems? This is nice. So, okay. So, oh, some inputs are coming. It would be interesting also to hear maybe in the discussion that we are going to have at the end about what is the actively using AI. So which solutions you are using. So we want to hear voices about this. Okay, I guess we can proceed. Okay, the three main aggregation are around this. So interest, not started, active use, exploration. So if we put together the 14, let's say 9 plus 5, it seems that there is an attitude towards the opportunities that AI could give. Okay, so if I may share the screen again. So, okay, let's proceed. So, what we have done in the perimeter of a project is creating a self-assessment tool, because the issue was in that stage, is there any tool, any way to evaluate the digital maturity of a long-term care organization? And let me tell you a bit the story. The story is that after a bit of research and literature analysis, having, let's say, the entire panorama about Europe, we came up with a couple of main findings, let's say. The first one is that mainly companies are working on that because, it's also obvious that there's an interest in approaching the market with digital solution on one hand, and on the other hand, we don't have an European comparison about this level of digital maturity. And this is still an issue, but thanks to our project, we are overcoming this part. So concretely, what we did was to create a tool for assess this level of digitalization, and so creating also a digital maturity benchmark. So having the opportunity to compare where your organization, our organization, as care provider is. So the issue is, where am I in terms of digital transformation? We have seen before, thanks to Anthony Institute colleague, that there is an issue of preparing the ground, having the right mindset, finding the right and proper technical solution, but where do we start? Which could be the criteria? And overall, how we could be more aware about this. And so what we did, we have created, thanks to a participatory approach with all partners and engaging also other stakeholders, an initial set of items for a specific questionnaire that started with 112 items. And then it has been processed, statistically speaking, to come up with what we are now going to share. And so we have created a tool that it will be available in 7 versions with these languages that you can see here. And to set it up and to find them, having the final version with roughly 50 items, let's say, we come up with 11 factors and a set of informations. And we deliver this survey over 24 summer time with a lot of care managers, because the ones who are in charge of investing money and leading the transition that we are discussing today are mainly the managers of the long-term care organization. So we reached out to 92 organizations, mainly in between, let's say, Germany and Italy, just to give you a flavor about where we came from. And it's interesting to have a glance at the kind of organization, the type of organization. So we are mainly talking about public ones, so roughly 60%, so 57%. Then there is the minor component of 16% of private ones, profit, and a quarter that is no profit ones. So it means that we have this large representation of public organization and a mixture of the others. But most interestingly, we have data about the size, so about the dimensions, and how you can see here. We have, okay, sorry, I lost my, okay, we have the dimension where medium size, so 50% are there. So this is an interesting information, because also in terms of economical power for investment, we need to be aware of the economical power that organizations could have, but also in terms of how many people do we need to engage? Because, one issue is to lead the digital transformation of a large organization with 100 or 1,000 employees, or a smaller one. So this is what this sample says, but in average, we are medium-sized organization. And then moving to the self-assessment, now we can dive into the tool and see how it was in terms of factors, how it is. Let's say we have those 11 factors that has been evaluated in terms of Likert scale between 1 up to 5. So what you see on your right side are the average values for each factor regarding this entire sample that became the baseline for the comparison between, for example, your organization and this 92 organization that feed the data. So we have, let's say, the most relevant ones are the ones in red. So the factor 2, that are investment and openness to innovative technologies, but is also correlated somehow with the quick survey that we did a few minutes ago. So it means that there is an interest, an attitude towards what could be opportunities in terms of technical adoption. And in particular, another relevant information is about the factor 6, that is the mental and physical stimulation through technology. So we got the impression that there is the interest to have something very concrete that could be implemented, let's say, in daily operations for taking care of older people. And mainly, we know that cognitive decline and also physical impairment are quite transversal in LCT organization. And so this matter the most. And we have also, let's say, two factors that are the 8 and 10, that are healthcare process optimization with AI and financial and medical personalization, but are interesting, and they are in blue color. I tell you why. Because in terms of standard deviation that we have calculated, the 8 and the 10th are the ones with more variations. So it means that beside the other factors that got less variation, so it means that there is more agreement among respondents. The 8 and 10, they have got this large, let's say, range of positioning of respondents. And it means, back to this, that there is not a coherent approach regarding how to optimize the use of AI or the financial use in personalization. Then, most interesting is moving to some open questions, open issues that we have, that are, for example, that the use of digital tools is seen as a potential improvement. This is one lessons learned, one takeaway lesson that we have. But one limitation, one barrier is it requires significant investment in user training. So it means, having the budget to do this. And secondly, we need to face also the digital divide. That is still an obstacle, still a barrier for the proceeding of this digital transformation. And it's not only a matter of digital divide from patient perspective or informal carriers, but overall regarding practitioners, but also managers. We have several stages regarding this and several positions based on the country, but we are talking about European panorama and it's quite different. So it's still something where we need to work on. And thirdly, we have this exclusive use of digital tools that may create barriers in accessing services. So it means that if we combine the digital transition with a digital gap that is still there, we could have something like a rebound effect. So on one hand, we could digitalize the access, but if people are not able to get access to it, it would be a trouble, a problem. So while digital tools could represent an added value, they are not considered a priority or a determinant on-demand service in elderly care facilities. So we need to be aware that, okay, there is hype, there is interest, but it seems not the priority. And we have another issue, that is we come up with both findings. So we need to improve efficiency and quality in elderly care. But here, let me say something. Before, it was stressed 2 points, that is how we can prepare the ground and then how we can, let's say, support the transition. But I want also to say that buying technology and adopting technology is not the magical solutions per se. There is a point that we are missing, but is the adoption of the adaptation and the right mindset of manager and people. Otherwise, once we consider the technical requirement, what is needed, and so on, and we don't have the proper why we need it and the proper how we can implement it, we lose a big opportunity. Sometimes we could see or have experience about investment, but after a while they are not, let's say, transformed in a really an added value. So just to let's say ring the bell of the awareness that without supporting accommodation in terms of learning and way of thinking and way of behaving of people, we cannot proceed ahead on this. Interesting is the most relevant use of environmental sensors, as we have seen also at the beginning of the webinar. This is something that is let's say improving a lot and is moving ahead in our organizations. And integration of health between various actors involved. This is still an issue. We have this interoperability open topic to work on. And ICT systems are interoperable and centralized, preferably managed at the regional level. And for example, in our country, but not only, there is a fragmentation between the databases and software and so on. So interoperability is still a challenge. So in synthesis, we have that digitalization is seen as a priority in key research areas such as nursing care, administrative management, rehabilitation, resident safety, remote monitoring, and vital signs. And these are the areas where, let's say, it seems that the investment and the adoption are mostly relevant. But now we want to hear your voices once more. That is, how would you rate digital skills within your organizations? We have said that is still barriers, so want to know where you are regarding this point. So please jump into Menti again, and Sonia, if you want, please to present. Okay, so this is a Gauss bell, it seems. So we are mainly in the average or low. So there is still a potential to expand the high and very high. Okay. So this is somehow related and coherent with our finding. And then we can move into the next. So let me get back to the presentation. And so the other question is about what are the biggest challenges in your organization that could benefit from technology adoption. So if you have to choose for the main challenge to be faced, please reply. So finance, money, staff shortage, yeah, lack of workers, quality, yeah, yeah. So we are all together in the same challenging situation. And let me say that this is an interesting result that we got. But this manager says, okay, we are interested about what's next and which opportunities we have, but we are struggling with the workforce shrinking. So it means that once also we could have resources, they goes first to personnel, you know. So somehow this is something that let's say reduce the opportunity to have not only economical resources but also a free mindset to invest in innovation. So it seems that the panorama is most related to overcome the daily operations, that is a challenge per se. So, say that this was the key messages that we want to share with you. And now you could have the opportunity to see how we have transformed in a live tool this questionnaires and data that we have. So I thank you once more and leave the floor to Duke University, to Martin Duchak, colleague. Thank you.
Thank you, Oscar. Good afternoon also by my side. My name is Martin and I'm representing Technical University of Košice, located in Slovakia. I would like to continue with presenting another activity within our project, DigiCare4CE. Once we have heard about what we have identified as the model for optimal digitalization process, innovation process within your long-term care facility, and once you have heard about the assessment model we have developed within our project according to the experience, according to the testing of the solution within the pilot actions, we set another, let's say, mission within our project, and this was how to present it to other colleagues within the field who would like to get more information about the innovations, about the digitalizations within their institutions. And so we have decided to build a little platform which would serve as the, let's say, supporting tool. We created the platform which is currently available at the website DigiCare4CE.eu. It is a web-based platform, so it is easily accessible, and there is no need to install something or register, and you can fully access this platform, which is currently available in English language as the main language, and there are also available national language versions, including the Slovak, Czech versions, German, Italian, and Polish language. This platform has been built as for the target group of the staff members of long-term care facilities and the management representatives, who we expect that they could find out more motivation and knowledge about the digitalization of long-term care facilities. And it includes the processes, what our colleague Aida has described, not only the main process of the digitalization within your facility, but also what we identified shall be done before and after. We have divided the platform into several basic sections. So it means the homepage, a long-term care digitalization assessment, a long-term care digitalization tool, insights, about, and the contact. So within the homepage, we have presented the clear, simple information, providing, we believe, the visitors the basic understanding what they can find on the platform. So it means the long-term care digitalization tool, the guideline for digitalization, and some news and more information from this field within the Insight section. As Oscar described, we have developed within the project the assessment model. So it means once you can answer each of 48 questions, which are divided currently into 11 categories, it means the assessment factors, we can provide you something as the basic evaluation of your current status. And we can provide you, let's say, more target assessment and advise how you shall further proceed on what you shall focus with your further step of innovation and digitalization. So the interface is quite easy. You can always see questions for which factors you are currently filling. You can see also the progress bar, so it means how many of the overall number of questions you have already answered. And you can, of course, restart the assessment once you would fill once again. And after you can fill all questions, you will be provided with the assessment, let's say, report. So as the main information, we will provide the overall score, which can be 1 to 5 based on the classic logic. 1 is the, let's say, the lowest, and 5 is the maximum. And you can see for each of the factor comparison of your assessment according to your questions, which already previously answered questions by other users. So it means this is the solution which would enable us also to constantly get the feedback from the future users, from the future visitors of the website who will fill this questionnaire, so we can also get more information and feedback from future users, and we can work with that and reflect that in our further steps. So it means you can always compare your situation with the average recorded in the database, and according to that, you can decide on which factors you will focus your further steps. You will be provided not only the nice chart describing your current position, but we have also tried to form quite short advice according to your current status. So it means the low, medium, or the high level of the digital maturity of your long-term care facility. And we are providing for each of identified fields, topics, the basic description, what is our recommendation for your further steps. But our general advice is that if you are even lower or better regarding the digitalization, our advice is to go to the model which has been described by Ida. But before you would like to get also more information about the new trends and good practices, we are inviting you to visit the Insight section, which is divided into categories we have identified as the basic, and it is the telecare and AI solution, financing options, long-term care system, LinkedIn, where you can find the LinkedIn shared fan page dedicated to the project, and also DigiCare4CE pilots. So it means in this section, you can find various topic-related information, which could provide you something like the good practices or the general information about, for example, long-term care facility systems within the cooperation countries participating on the project. So within each of the presented articles in the Insight section, you can still find the text which has been composed by the project partner describing the particular topic. We have tried to make it user-friendly, to develop that in the, let's say, more nice presentation, using the various types of the fonts, and also to provide you some schemes when it is relevant. So not to be too long for reading, to be more user-friendly, and to provide really the valuable information for further proceeding or for general understanding how the long-term care facilities or concrete good practices are working. One of the most, let's say, valuable output of our project that has been presented by Ida is our digitalization model. This model described all the steps we have identified as very crucial for being implemented before you will start with the implementation of digital innovation during this process or after this process. We have divided these steps into 7 basic sections, which is currently on the screen. And there is also the section definition of terms, so you could understand better the concrete terms from this field. Some of the sections, as it includes quite a lot of content, they are divided into subchapters. So it means the concrete categories of the information for the particular step of the process. We have composed these chapters, including description of what we consider as the crucial to be done, not to forget some kind of the very needed steps to be implemented. So really, it can serve you for your further development as something like the guideline, providing you step-by-step guidance from the beginning of the process, through the process, and after what shall be considered to be done. We have tried to highlight most crucial also information, so it would be more visible. And also we are sharing with you some kind of the templates, like we can see here the market research template we have been using also during our pilot action, implementing the concrete innovation within our own long-term care facilities. So we are providing you something what has been already tested in within our pilot actions. But of course, for the further development, we will be more than happy if you could provide it also further feedback, and we could improve this content. As I mentioned, also we have defined the basic terms, providing maybe to less skilled staff members the basic understanding of long-term care facilities, digital transformation, digitalization, and digital maturity. So what it includes, what it describes, so you can better understood also the concrete chapters within this digital innovation model. Also, as we are working on all of these activities under DigiCare4CE project, which is founded and so supported by Interreg program, we have described overall our project, which is aiming at the digital transformation of long-term care facilities for older people. So within the section about, you can read more about our project, about the consortium, and what are we working on. Of course, once you would like to get more information about our project activities, you can still visit our official project website, where we are on the constant basis updating our followers what is currently going on and how you can cooperate more with our consortium. And you can always find there or on the official website the list of project partners, so the partners in your country maybe, and please don't hesitate to contact them for further information or for potential for cooperation. Also, you can find the contact information on this dedicated website. There's the contact for the lead partner or for my colleague regarding technical issues. So for further, let's say, feedback to our work, once you would like to share with us your opinions, your experience, we would be more than happy, so we can also tune this content for the future users, which has been just released in the beta version. So we hope that constantly we will be able to improve this content also with your help, and to better serve with the other potential long-term care facilities in your countries, according to the knowledge and experience we get through this DigiCare4CE project activities. So it would be all by my side. And as the next speaker, I'm inviting Pavel.
Thank you, Martin. It's my pleasure as a communication manager of the DigiCare4CE project to conclude this webinar. But before that, I would like to open the floor for your questions. So, does anyone have any question about what we have covered so far? So now it's the moment. So please feel free to ask. We are here for you. There are no question in the chat, and well, it seems that we have covered everything. Everything is clear, so that's that's good, a good and message for us. And well, thank each of you for joining us, and I believe that Today's session or provided you valuable insight and fresh ideas for digitalization of care facilities. And I would like to share the last two slides of my presentation. I hope you can see it. Um, well, on the slide, you can see a link to the project website for more information, and you are more than welcome to follow us on LinkedIn. LinkedIn is our main platform for communication. We regularly share updates, insights, and information about upcoming project events. So make sure that you are connected with our community. And um, well, over the past 90 minutes, we have explored one model and two key tools that can support care facilities in their digital transformation. The DigiCare4CE model presented by IDA, it's a transnational framework that serves a reference for digital readiness of long-term care facilities, and this model helps organization strategically plan their digital transformation in the short, medium, and long-term period. And the self-assessment tool presented by Oscar, this is a tool designed to help organization evaluate their level of digital maturity. And with input from 92 long-term care organization across Central Europe, it provides valuable benchmark to guide facilities in their digital journey. And you are also encouraged to continue using this tool and contribute your responses, and as it plays an integral role in the DigiCare for CE online tool presented by Martin. And this practical tool offers tailored recommendation, advice, and resources to help care facilities adopt the digital solution effectively. So, and I think that we can all agree that digitalization is already happening, and we have also seen it from the Mentimeter answers that none of you are skeptical about AI. So to make the most of it, from digitalization and AI, we must prepare well to these facts. And if we do, digital tools will help us reduce the workload of care workers, improve the quality of care, and tackle some of the biggest challenges in the long-term care sector. And at the same time, we know, and it was also mentioned in your answers on Mentimeter, that digital transformation requires money, requires investment, it requires training, and overcoming the digital barriers. And before I conclude this meeting, I would like to invite you to an event that I believe will be truly valuable for many of you. On the slide, you can see the invitation. On November the 19th this year, our Austrian project partner will host a policy conference in St. Pölten. And this full day event will focus on digital transformation in long-term care, of course. And the conference will feature inspiring keynote speakers, a panel discussion on best practices from our project, and also interactive breakout sessions, breakout rooms, uh, where you will have the opportunity to experience the digital solutions firsthand. So if this is if this sounds interesting to you, please save the date, 19th of November this year, St. Pölten, Lower Austria. And by the end of this week, I will send you a follow-up email with a link to the webinar recording. This webinar is recorded, as Martin and Sona mentioned, and it will be uploaded on YouTube. So you can share the link with your colleagues. And I will also share with you again the invitation to this conference in St. Pölten. And well, once again, a big thank you to our speakers for their presentation, and to all of you for your participation. And yeah, I look forward to staying in touch with you and continuing this important conversation on digitalization of long-term care. So have a great afternoon, and I wish you a success on your digital journey.
Thank you, Pavel, for your sum up and final words regarding our webinar. There is one question from Jessica about the digital tool, and this was the rollout of our tool. So it was not used yet, but we are really looking forward to have many users and to get your feedback. And whenever there are questions, as Martin showed in his presentation, feel free to contact us directly, and stay tuned with us via LinkedIn, and then you will be updated on our future progress of the project.